Hello, thank you for this opportunity to talk to you today. My name is Alana Ward and I'm an information scientist in the National Rare Diseases Office. Today I want to briefly outline the work of the NRDO, our information line service, and also to let you know about our Care Pathways project, in particular the development of a national care pathway for neurofibromatosis type 1. The NF Association Ireland have been central to this work. The National Rare Diseases Office was established in 2015 and is based in the old part of the Mater Hospital on Eccles Street, Dublin. Professor Eileen Tracy is our clinical lead, and we have a number of core roles. You may have heard of the Department of Health's National Rare Disease Plan and the HSE Model of Care for Rare Diseases. We drive and support the recommendations in these key policy documents. The Minister of Health, Stephen Donnelly, committed to the development of a new National Rare Disease Plan in February this year on Rare Disease Day. We manage the Irish part of the Rare Disease Portal Orphanet, which maps out national rare disease clinical expertise and national patient organisations. We are a coordination hub to support the Irish clinical experts and help to integrate European network care into the Irish healthcare system through the ERNs, or European Reference Networks, which are networks of healthcare professionals across the EU who share knowledge and expertise in rare diseases. We support and contribute to rare disease education, training and research. We also have an information line which I want to tell you a little bit more about. Our information line provides current and reliable information to people with rare conditions, their families and healthcare professionals, patient organisations, researchers and policymakers. We can help to signpost to national and international experts in the management of specific rare conditions, link families to patient organisations and social care supports, provide information about clinical research projects and clinical trials. However, we do not run a rare disease clinic, so we can't make a diagnosis or give individual patients clinical advice. NRDO are committed to informing, supporting and empowering people affected by rare conditions, their families, caregivers and healthcare professionals. You can contact us on our information line by emailing or phoning. We have a website with information about our service and useful links to other rare disease resources. We also want to update you on our Care Pathways project, which you may already be aware of. We've been progressing the development of care pathways for around 25 of the more prevalent chronic rare conditions, with a focus on conditions with multiple needs. NF1 is one of the conditions selected. The care pathways are based on published clinical practice guidelines, reviewed and developed by our national clinical experts in the centres of expertise, with the patient voice as central through the national patient organisations. We hope they will lead to more timely diagnosis, more coordinated integrated care and positive patient outcomes. Our study has two phases. This diagram shows the steps used in phase 1. Conditions were selected based on the more common chronic conditions affecting multiple body systems and needing input from lots of different medical specialists. Clinical practice guidelines were used to develop preliminary care pathways. Irish clinical experts were identified and asked to map these onto the Irish healthcare system. Patient representatives were identified through the national patient organisations. NFA Ireland is the patient representative for the NF1 care pathway and provided really comprehensive and highly valuable feedback. The feedback received from NFA Ireland and other patient representatives highlighted the need to develop not just the medical, but the more holistic aspects of the pathways. This led to phase 2, involving a wider stakeholder consultation and HSE senior management final authorisation. We had engagement with multiple health and social care professionals, with representation from nursing, psychology, genetic counselling, disability services, medical social work, physiotherapy, dietetics, occupational therapy, and speech and language therapy, to ensure these critical roles were captured in the pathways. 18 health and social care professionals fed into the NF1 care pathway, which I am pleased to say is now at the final stages, just prior to presentation to HSE senior management for approval as a national care pathway. The NF1 care pathway is being developed under Dr. David Coughlin, consultant paediatrician and clinical lead of the NF1 multidisciplinary clinic at Children's Health Ireland in Tala Hospital. Engagement with other specialist hospital consultants from clinical genetics and oncology was also sought to ensure the correct clinical standards and cancer tumour guidelines were met. Here is the basic template of our care pathway. The diagnosis section lays out how the condition commonly presents, the diagnostic criteria, and which disciplines and clinicians are involved in the diagnostic process. This also includes assessments and testing that are required, including genetic testing. The following sections to the right include key hospital specialists involved in care and management. These include the general paediatrician, dermatology, ophthalmology, specialist nursing, genetic counselling, and psychology. As NF1 is clinically very variable, not all patients need to attend every specialist, so the blue section highlights other hospital specialists who may be involved if needed. There is a strong focus on holistic services and supports in the purple section, which outlines the role of occupational therapy, physio, speech and language therapy, dietetics, and social work. The pink community and primary care section covers the role of the GP, the importance of community ophthalmology for older children. We know that children with NF1 syndrome may have difficulties or delays in development. Some can have their needs met by their local primary care team. Others will have more complex needs and will require referral to their Children's Disability Network team. This section also highlights the importance of the National Educational Psychology Service and key roles of the patient organisations, NF Association Ireland. So let's step through the pathway and look at some of the more detailed content to see how pathways may be useful. Here's our landing page. This is an example of one of the key hospital specialists, ophthalmology. So we could imagine that you may be concerned that your child is only having occasional eye checks in the community. You and your GP could sit and check the ophthalmology section of the pathway and see what screening is advised and at what ages. So you can see that up until 10 years of age, children should really be attending a hospital ophthalmologist, and these checks should be carried out at least yearly. Each healthcare professional role can be seen in detail. For example, here we have another key specialist, the general paediatrician, and they really are responsible for yearly follow-up and monitoring. This may not be happening on the ground, so this document is a standard which can be used to advocate for this level of service for you and your families. You may be attending a community physiotherapist who may have never managed a child with NF1 before. The physiotherapist can use the pathway to see what types of issues children with NF1 can have and what therapy is recommended. And here again, we have the more social and holistic role of the social worker. You can see how important it is that they are supporting families to access psychosocial support, links with community services, financial support, other issues in terms of accessing housing, home care packages, respite care, and employment issues. We hope these care pathways will have a very positive benefit and impact by increasing knowledge and awareness of NF1 amongst patients and healthcare professionals also. This can empower patients to have confidence to navigate the health service, support the delivery of integrated coordinated care by enhancing links with primary care and community services, improving access to social care supports, improving communications across disciplines and services, clarify roles and responsibilities for healthcare professionals, and also as an advocacy tool. The goal is improved patient outcomes, reducing time to diagnosis and improving the effectiveness of meeting patients' needs. Of course, this is just the first step. These pathways will still require funding to drive implementation so that real improvements can be experienced by patients and families when accessing services and supports on the ground. I'm delighted to say, as of this week, our first 9 approved care pathways are now available on the NRDO website, if you wish to take a look. So that's www.rarediseases.ie. Once the NF1 care pathway is also approved by HSE Clinical Management, it too will be available on our website. So thank you to the NF Association Ireland for your invaluable contribution to the development of the NF1 care pathway. Your insights will impact not just the NF1 care pathway, but are also really important for all people with rare diseases and highly relevant across all the care pathways. So thank you. Finally, I would like to acknowledge everyone working on this project, the team in the National Rare Diseases Office, the many patient organisations and representatives, HSE clinical leads and their teams, and the numerous health and social care professionals on the wider stakeholder group. Rare Diseases Ireland, the National Patient Rare Disease Organisation Alliance, are our patient advocacy partners and have ensured that the patient's lived experience is captured across all care pathways. And of course to you here at NF Association Ireland for your invaluable contributions. Many thanks.